you, Eric?
Thank you. I'm really humbled and excited to be speaking with all of you today. And let me share my screen. Today I wanted to talk about sense of purpose in life and how it's associated with health and well-being, as well as how it may be thought about in the work context. So addressing 3 questions today in the next 20 minutes or so. Does a sense of purpose matter for health and well-being outcomes? Does a sense of purpose matter for work metrics and outcomes? And finally, how might we intervene on sense of purpose in the workplace? Before moving on, the definition of sense of purpose, people conceptualize it in different ways, but this is how we think about it in our lab. It's the extent to which people experience their lives as being directed and motivated by valued life goals. And we assess these kinds of things using standardized questionnaires. And on the bottom, you can see some of the items that are used to assess this type of topic. This is a helicopter level view of what we're going to be talking about, the theoretical model, and we'll move on to interventions and finally end with future directions. So this is adapted from a recent review that we published, and we think that factors like work and volunteering go on to influence and heighten our sense of purpose, and in turn, purpose informs what types of work we do and what types of volunteering we do and how much effort we engage in it. And I'll talk about this more in future slides, but this is an overview. And in relation to health, for example, we think that purpose works through several different mechanisms. The stress pathway is one of the mechanisms. So psychologists are experts at knowing how to stress people out in the lab. We have really great techniques of doing this, like asking people to do a speech or do hard math problems. And this reliably influences different biomarkers that are markers of stress. And when people are stressed out, we actually find that people with high purpose actually get stressed out in similar ways when looking at biomarkers, but they actually recover more quickly than people with lower levels of purpose. And this has been replicated in different types of paradigms and different biomarkers and different types of study designs too. Psychosocial mechanisms is another pathway. So people with higher purpose, these are all longitudinal epidemiological studies. And people with higher purpose generally have lower loneliness, more frequent contact with friends, lower depression, higher sense of mastery, and higher life satisfaction too. And these all have been independently associated with better physical health outcomes as well. Behavioral outcomes, higher purpose in general is associated with more preventive healthcare services, like more cancer screenings and various other healthcare services too. People with higher purpose also engage in more physical activity measured by both self-report as well as different Fitbits and different types of more objective markers. Interestingly, higher purpose is not associated with smoking or alcohol in cessation in older adults, but it is associated with lower likelihood of drug misuse over time, better diet, and the evidence with sleep is mixed. People with higher purpose generally get fewer sleep hours, but they get higher quality sleep. Biologically, purpose has been associated with an array of different biomarkers, including lower inflammation, better glucose regulation, and lower allostatic load, which is a marker of stress. It's also been not associated with other important markers, so there's a lot of null associations that we're seeing in the literature too. And for these reasons and others, this is perhaps why we see that higher purpose is associated with lower risk of things like cardiovascular disease, stroke, Alzheimer's disease, cognitive impairment, and specific types of mortality. So this kind of research is also influencing multiple different arenas. So every 10 years, American Heart Association comes out with the 10-year vision of where they want to invest policy, research, and practice efforts. And they got together the Presidential Advisory Board, and I was excited to see that purpose in life is one of the factors that they're really thinking about for the cardiovascular arena. And the American Heart Association also published this report recently, which talks about the importance of psychological well-being factors like sense of purpose, but also others too, like sense of hope and optimism and resilience and these kinds of factors too. Let's go on to an overview of interventions. Is there an appetite for more purpose in the workplace? And there's many ways of answering this question, but if we look at all the top consulting companies that have major human resource branches, every single one that I've seen at least has one pamphlet and multiple actually, and lots of content and material on the importance of purpose in the workplace. Why might employers care about fostering a sense of purpose and meaningful work among employees? This is a recent meta-analysis that was published two years ago, and They meta-analyzed several different types of studies looking at different outcomes, including ones that are key business metrics, including things like engagement and commitment to work, as well as withdrawal intentions, which is a great predictor of someone quitting their job, and an array of other factors too. And here you'll see the sample size for each of these outcomes that they looked at. And all of the studies, they find that purpose and meaningful work is pretty strongly correlated with all these kinds of factors. And a lot of the research still is cross-sectional, but there's a lot of great longitudinal research that has been emerging in the recent years, and even intervention research as well. Another reason is that higher purpose is associated with healthier workers, as well as reduced healthcare costs. So this is data from claims data from United Health Group, which is a big health insurance company in the United States. And if, for example, you look here, these are people with low purpose in life, medium purpose in life, and high purpose in life. And they looked at all kinds of different outcomes, things like healthcare utilization, healthcare expenditures. And let's focus in on healthcare expenditures here. And PM represents per member per month costs. So people with low purpose were costing the health insurance company $1,288 per month. And people with high purpose, they were costing the healthcare insurance company $870 a month. And if you start aggregating these monthly costs over years and decades, you can actually think about the different healthcare cost trajectories of people with high and versus low purpose. And as we saw in a prior slide before, there are many mechanisms which might explain this, like people with higher purpose, for example, act in healthier ways and therefore have lower chronic conditions as well. And this all translates into how people show up in the workplace as well. So can sense of purpose and meaningful work be enhanced? This is a great question where a lot of research is being done. And this is a great review article that was published 2 years ago, features of work associated with meaningful work. And I encourage you to jot this down. And I'm also happy to share the slides with anyone too. So please feel free to email me and I'll send that to you. But at the organizational level, these are the kinds of factors that people have found are quite important and associated with meaningful work, things like ethical leadership and empowering leadership. And you all can read faster than I can speak. So I'll just let you read this for a few seconds and please ask questions at the end too. And then I'm gonna move on now to other level factors that are associated with meaningful work, things like job performance, positive affect, which is just a term for kind of positive emotions, intrinsic motivation, and shared experiences too. And I'm working with United Way headquarters, and we're trying to help foster better volunteering experiences for the volunteer too. And we're trying to re-engineer more of the volunteering experiences as shared experiences too. And at the job level, these are some of the key factors on the bottom that are associated with more meaningful work. There are many interventions that have been shown to be able to increase the needle on meaningful work. And one really promising one is called job crafting. And this is work done out of the University of Michigan. And a question that is often asked is, what if it's different types of jobs? What if these only apply to maybe white collar jobs or at the C-suite? But they've done this kind of intervention with all kinds of people too. For example, they've done it with people in hospitals at the University of Michigan, and people after going through this exercise kind of reconceptualize their jobs in different ways. For example, people helped to realize that they were actually helping with the healing process and not only maybe cleaning specific things. So this kind of exercise helps people realize new things in new ways, and it's really encouraging and important work. Another type of intervention is called superordinate framing. So what is superordinate framing? We might think about how one's meaningless task at hand and how it builds on other tasks like a jigsaw puzzle to achieve and unlock higher purpose. So an example that might be given is a hospital administrator. And this trio actually did 4 experiments with 3,500 people. And they asked people to think about a task that they thought was meaningless. For example, maybe a hospital administrator who was filing away different files in alphabetical order. And when they were asked to consider the broader purpose of a task without doing more in-depth level work like you do in job crafting, it actually backfired and people thought the task was even less purposeful and less meaningful. However, when they were asked instead to think of the meaningless task in relation to other tasks and how that might enable and unlock other larger purpose tasks, people actually found the task more enjoyable, meaningful, and motivated. So for example, if people were filing away the cabinets in alphabetical order, different patient files, but they thought about how this might, in an emergency, actually enable people to save lives, they actually found those kinds of tasks more enjoyable, meaningful, and motivating as well. There's also a number of great research interventions that are being accumulated in the research literature. They differ on different types of form. For example, they can go anywhere from meaning-centered, group-based modularized therapies to more community-based modularized therapies. There's also other programs where people go through different modules and think about their life in different phases of life and write about it and share about it intergenerationally. And these are all kinds of things that have been shown to increase sense of purpose and meaning in life. And David's group actually has been working with Ed Diener and others who are top positive psychologists, and actually they collated some of the best evidence. And from my understanding, I think they're digitizing these things, and that's really exciting frontier. Future directions. From a research point of view, I think it would be great if we can ask more meaningful work questions in the large data sets that are being asked, especially in the health epidemiological cohorts, because often these kinds of questions are not asked, and it's more of the traditional psychosocial questions like depression which are asked. So this is something that I'm constantly kind of advocating for. I think it'd be also great for people to researchers and people analytics teams to get together, because those are really unique data sets that can unlock really interesting insights. It would also be great if researchers and different companies can work with management consulting teams, because they advise a lot of the largest companies and it can help facilitate dissemination. And finally, directly working with the largest employers, but not only the largest employers, but all kinds of employers too. And there could be great innovations that are spurred when we think in this way and partner with researchers and great companies like Thrive and large and small and all kinds of different industry partners as well. So that, that's the end here. I wanted to acknowledge all of the great people in our group, and I know that we went through a lot really quickly, so I'm looking forward to the Q&A section where we can dive in more depth in all of these kinds of questions that we covered today.
Great, thank you, Eric. That's a lot of stuff in a quick time. It's very much appreciated. So this is a great time for anyone to use there's the Q&A function. If you have questions to ask, please get them in there. If you don't see that button, you can use the chat button, but Q&A is the normal way of doing it. And maybe just while those are coming, when you talked about job crafting, and it'd be great to hear about some of the examples that you've seen both in the research and which types of things work better or worse, and also practical examples on the ground. And I'll leave it at that for the first step.
Yes, yeah. People, when they go through these steps, they go really in depth about different aspects of their work, and people actually find that they're able to think about their new jobs in entirely new ways that are more meaningful to them. And other things that employers find is that when they go through these things, they actually find that they can maybe even modify someone's job or move them to another position within the company as well. That's even more fulfilling for them. So these are some of the outcomes that are really exciting outcomes that I've seen from these kind of deep thinking about job crafting. Yes.
And is the norm on that it's more, what's the collaboration between the employee and the manager and the organization, and who makes who does what to make that crafting happen?
Yes, yep. So then I've seen it been done in different forms of people bring in these exercises with the facilitator that's been trained, and then they take a session. It might be an afternoon to go through these exercises, and they do individual and then group level discussions as well. And then after these kinds of insights come out, there are other people in the room who know of different types of ways in recrafting someone's job, or even allowing them to move to a different position because there's needs within the company as well. in some way too, during the pandemic, people have kind of naturally been doing this exercise in some way as well, thinking about their core values and yeah. So, but there's structured ways to do this as well.
Looks like we have a question that came through Q&A. So it says, hi, Dr. Kim, how can introverted people achieve a sense of purpose in life and work, considering socializing with peers at work or having friends is an emotionally heavy task for them?
As a fellow introvert, I think I'm trying to think of literature on this. One thing that you might want to look at it too is there's a concept of highly sensitive people, and sometimes it has a negative connotation, but it doesn't have to be taken that way. For example, a highly sensitive person might just take in more information per unit of time, like visually or audially, and then kind of get overwhelmed over time too. So if that's the case, there's a great talk, if you YouTube highly sensitive people and Google Talks, there's a great summary talk there where they talk about all kinds of ways in which you can kind of navigate this kind of space. And you can do things like take short amounts of time to engage with others, but also I think the type of position, finding types of positions that are very conducive to that type of wonderful personality is maybe one of the best ways. Yeah.
Could I ask a follow-up there? Yeah, so you're leading, what are the good types of positions then? Just to follow up on this question, what are examples of where people like that will thrive?
Yes, yeah. Usually introverted people do a lot of deep thinking and great observing of different things, whether it's human dynamics or systems. And then any position that allows for that type of time is probably great. So researchers are a great one, coders, think tank policymakers, grant writers who are maybe working with nonprofits behind the scenes in that kind of way. Those are the ones that come immediately to mind.
I think we have a second question here. This is a good one. Is a sense of purpose changeable? You mentioned at the beginning, if people have a higher sense of purpose or a lower sense of purpose, then they volunteer or are focused on their health. So to what extent, if any, did you see examples of that changing for individuals?
Yes, yep. So purpose and the conceptual cause and meaning is both modifiable. And I didn't talk about this in the talk, but there's a great conceptual model that has been released recently by reviewing the empirical and theoretical work. And the overarching concept is actually meaning in life, and underneath it are three different core components in order to have a meaningful life. And one is a sense of coherence. Do I have a life philosophy that can make sense of my life and the world around me? The other is a sense of significance. Do I objectively think, and do I subjectively think that what I'm doing is significant? So for example, a pediatrician who's been working for 20 years, the world might objectively think what they're doing is great and important and significant, which I think agree to, but subjectively they might be so burned out that they no longer believe it. So there's two dimensions to that. And the third dimension is a sense of purpose, which is direction and purpose in life. So there's great evidence, or there's emerging evidence that things like purpose can be increased as well as meaning. And coherence and significance, there's less evidence, but there's a lot of promising practices and interventions that are possible. Within the purpose intervention and meaning intervention research, there's different types and subtypes of interventions. One is group-based or individual level therapy, and it was the origins of it go back to a great psychiatrist named Viktor Frankl, who has a fantastic book called Man's Search for Meaning, which is my favorite book. And basically what people do is revisit their core values and hone in on them and allow those core values to inform different activities throughout the day. And then that has been actually one way of increasing purpose at the individual level. And at the group level, there are great interventions where people with different types, the same type of disease condition will actually get together and go through specific modules. So meaning-centered cancer therapy is one that has shown large effect sizes. Another group type of therapy or purpose intervention is kind of the life review paradigms, which I briefly mentioned before, where people go through different modules, and it works especially well with older adults. And when they go through the different types of life stages and then write about them and then share them in some form intergenerationally appears to work particularly well. That's another great way. Volunteering is another category of purpose intervention, especially with people who don't have a lot of role identities and might feel lower on other things like significance in life. Volunteering is actually another great role in which it can increase purpose and both meaning in life as well. Another version of that is called Experience Core, where it was actually developed and studied at Johns Hopkins, and they actually pair retired older adults and teach them how to tutor with underachieving elementary school students. And it's a really great win-win situation because the students' grades are going up in all different types of subjects, and the older adults are actually healthier too. They're actually taking more steps, and they do things like brain imaging scans, and their brains are healthier over time by participating in these types of interventions. Another type of very kind of, I wouldn't recommend it right now, but there's so much interesting new research on it. It's actually different types of psychedelics, where people are actually finding out and unlocking deep things about themselves, like traumas and things, and helping reduce things like depression. And they're finding that meaning and purpose is being increased. But the much safer version of that is individual level, kind of more traditional psychotherapy too. So those are some of the categories that I think about when trying to increase meaning and purpose at the individual level. And I showed that great review article, which talks about organizational level factors, and I'm happy to send the slides.
Awesome. All right. Our next question, which you've kind of addressed in a few ways, is how do employers go about creating the right environments for employees to find a sense of purpose? And there's a couple of follow-up questions further down I think we can use as further discussion there too.
Yep. So yes, these are some of the organizational level factors that have been associated with more meaningful work. And it really does depend quite on the way in which the organization is structured. So it would look different depending on if it's a nonprofit or educational system or healthcare system or like a startup or a large company. But these are some of the main ingredients that people can kind of cook with as they figure out which kind of practices that they want to deploy in their organization. And then this is the next level too. So I think if there was a little bit more specificity, I could be a little bit more specific too, but these are the general principles here.
I think one follow-up question that I'm just going to jump it further down, then we'll address the one in the middle. One follow-up question is around employees who might not be comfortable or forthcoming in sharing their feelings with their organization. And so what might some suggestions be there for understanding and tracking sense of purpose in the workplace in a safe way for those folks?
Yeah, there's a great research done by Google, and it was called Project Aristotle, where they did very systematic data collection, and they found psychological safety is one of the top factors that have been shown to be associated with the highest performance. And then they actually have a toolkit that you can download for increasing psychological safety in the workplace. So that might be one way of starting down this avenue. And I don't remember the specifics to the toolkit, but if you look up Google psychological safety and Project Aristotle, I think it'll lead you pretty quickly to that toolkit. It's true. The companies that are assessing these things, that's the question that comes up pretty soon. Like how is this data going to be used? Is it going to be used for performance and bonuses and raises and letting people go. And people have to establish kind of how the data is going to be used really upfront and early on. And those are the kinds of companies that I've seen where it's been more successful at being implemented too. Yeah, and another thing is this works better for a bit for larger companies, but having dashboards where it's more aggregate level data and people feel even more comfortable when that happens.
Awesome. Yeah, there's a couple more questions here. One is around on the topic of sense of purpose changing, whether or not it tends to change longitudinally as people age. So whether the sense of purpose that motivates someone at, say, the age of 30 would have the same benefits at the age of 50. And tied to that, whether people find it harder to find a sense of purpose as they age.
Yep, that's a great question. I want to show this. From another presentation, which answers this question. So this is actually the inspiration for my research. This is a picture of my grandfather, and he ran an orphanage for his entire life, and he was extremely healthy. But there's a mandatory retirement age, and after he retired, I saw his health behaviors really declining, and that's something that I was stuck in my mind, and I wanted to study this quantitatively. And to my surprise, people weren't really quantitatively studying this, the topic of purpose in relation to health outcomes. So that's what I did, starting in undergrad actually, and I've been doing for the rest of my life too. And if we look at nationally representative data sets, and this is data from the US, there's no equivalent data that I can find for Canada, but each bar represents about 500 to 800 people, and it can be thought of like a 4-year mini longitudinal study. And these are kind of 53-year-olds, and these are 54-year-olds and their 4-year trajectory purpose. And what you see here is that it starts leveling off from about the age of 50 to about 65, 70, when a lot of people do retire, but it starts declining quite rapidly after, actually. It declines about 20, 25%. And what's interesting is that when we look at other countries, like some East Asian countries, like Japan, for example, this remains very much high until the 80s, and then it starts declining quite rapidly. So it might mean that this is not necessarily kind of a thing that happens, but it might be a social structural factor where if we kind of change elements of society, we can actually change the way that people's age-related purpose changes. And yeah, so I think this is an exciting avenue for many different sectors, including the employment sector too, thinking about ways to reconceptualize what an employee is, maybe having kind of semi-retirement or more part-time positions where people can relay all the incredible wisdom that people have accrued over decades. Another reason why people's purpose generally declines into older adulthood is because of loss of role identities in life. So a lot of the reasons and ways, a lot of our behaviors and our thinking and the ways we relate to one another in society is actually dictated by different and various roles that we have in society. But as people age, things start happening, like close family and friends start passing away. Our jobs sometimes are no longer there. And then there are these other factors too. And as we lose more and more of these roles, we lose more and more purpose just generally. So if we can find more and more roles that people can have into older adulthood, that's a great way of increasing sense of purpose.
Thanks so much. Switching gears slightly here, just the next question is about whenever purpose is mentioned here, it seems to be altruistic, and wondering if that has to be the case for this research to stand up or hold true.
Don't have data on that, but I have a theory that I'm working on right now. I'll explain really briefly. Goal pursuit in and of itself is highly enjoyable and produces all types of different varieties of psychological well-being. And then I think the more if we think of our lives as a circle and concentric circles, like this is our local group and more macro groups, the more basically outward facing our values and purpose are, then the more the group will reinforce you. They'll kind of reinforce your goal pursuit and well-being, and that might translate into better things like health outcomes. But the more kind of self-directed these are, maybe things like that are very selfish or something, the more kind of psychological paper cuts that people will give you, because they'll kind of like penalize you maybe. And then that might lead to worse health outcomes. This is all theory right now. And in reality, everyone is a mixture of these kinds of things. There's no kind of like purely, actually there probably are, but most people are mixtures of these kinds of things. Yeah, another thing too, which is really interesting, is that the type of purpose also really matters too. So in the data, I showed you that purpose is associated with some better health behaviors like better sleep and exercise, but not associated with other things like binge drinking and smoking. And when we look at the data, we actually find that people with high purpose both drink less and drink more, and drink less and smoke less and smoke more too. And one of the reasons might be that their purpose is actually different. So if we think of someone who says, I want to see my grandchildren graduate college and get married, and like, yeah, they need to remain really healthy. But if the purpose is actually, I just want to see this social justice bill passed in the next 5 years, and I don't care what it takes, then I might actually cope by kind of maybe even drinking more and smoking more. So the content of the purpose matters quite a bit. Yeah, but in general, it's a good thing. It's just some of these extremes.
Yeah. The next question is also on how purpose is tracked and understood in this case. So this question says, it sounds like you're describing purpose as a one-dimensional scale that starts at 0 and goes upwards. You have it or you don't, and you can increase the amount. Could a lack of purpose instead be described as distress over a perceived lack of purpose? And could you achieve similar results by training people to not seek purpose at all and to instead seek other qualities such as peace or joy?
Yeah, there's some other scales that can be looked at in this way. There's, for example, search for purpose and meaning versus presence of purpose and meaning, and that's two different things there. People generally find that if you're searching, then you have higher distress, and if you have presence, then you have less distress.
Mm-hmm.
This is, yeah. I can't think of research on there. This is, oh, there is some research on orientations to happiness, and then people actually weight different types of factors more or less. And when I think seeing through that prism, I think this makes a lot of sense actually, what this person is saying and asking. So I think I have met people who really don't value this factor a lot and appear to be doing well. I don't know what they would look like in the long term, but yeah, I think people have different orientations to kind of happiness and well-being, and it's a possibility.
Awesome. Thank you. I think we'll save the question on literature recommendations perhaps for the end, but next question is around intrinsic motivation and purpose vary across individuals. Are there validated strategies that can help employers better understand what these individual differences are, such as like validated studies on types of people and groups, and develop approaches to addressing these individualistic differences in the workplace?
Yes. So I can't think of something right now on the purpose literature, but I was trained as a clinical psychologist and epidemiologist, and I'll dive into the clinical psychology literature. When people have treatment-resistant depression, one of the very effective ways of helping people come out is called behavioral activation. And what we do is have lists of values, things like family and altruism and other things like this. And they can be found online, long lists, and then we print them out and ask people to circle them and then reduce and keep on reducing. And the final ones that they have are kind of their core values. And then we ask them to structure their week in such a way where a lot of their core values are reflected, and people's depression actually can be alleviated through this method. And if we, this is conjecture here, but if we abstract this to work life as well, finding people's core values and seeing what kinds of tasks that can more match onto people's core values, I think that could be a really powerful way, potentially powerful way of increasing well-being and purpose as well. Another way to think about this is character strengths. So there's something called a virtues in action questionnaire that can be taken, which scientists have actually classified kind of 24 different character strengths that are pretty universal across different cultures. And people have found that when you identify them and then try to deploy them in new and interesting ways, people's well-being can actually increase too. So that's another promising avenue. I haven't seen it directly linked in with purpose research, but I think it kind of taps into that kind of question. Yes. Yep.
I think just jumping around the questions here, there's a couple that are a bit more direct follow-ups to that. So on the one hand, there's two questions here. So one is, do employers still see benefits from supporting their employees' purpose, even if the purpose is not related to work? And tied to this, I mean, and a bit more broadly speaking, do we know what the most common type of sense of purpose is? And are any of them, quote unquote, better than other types?
Wow. So yeah, these are anecdotes I've heard, but so when some people go through these, a lot of people find ways in which they can recraft their jobs and or stay within the same company and go to different positions. But some people actually find that, like, I'm stuck in this job and I actually don't like it, and it might be a good thing actually if they do leave, because they might be underperforming too. So then that might be actually a way to help people fulfill their own purpose and create better well-being for their lives, but also allow for another person where the job might be better to enter. Can you say the question again? Sorry, I forgot that original.
Sure. The first one was, do employers still see benefits from supporting their employees' purpose, even if that purpose is not related to work?
Yep. I can see some pathways where, yes, even if it's not related to work, they might be healthier too. And then if they're healthier, then they might perform well. And going one step back, they have better health behaviors generally too. And then these things translate to better outcomes. There's also research on life satisfaction and how that's associated with better work performance, and purpose can drive better life satisfaction as well. So I think I can't think of direct studies on this, but if we link together different chains, I think it's possible. That's also a conjecture though, so yeah.
Fair enough. All right, there's a couple, again, two questions that are related to each other. So whether there are studies being conducted with regards to a sense of purpose for immigrants as they move to a new country and are physically and culturally removed from, say, their original sense of purpose. And then, yeah, so to what extent have these studies, have these qualities been studied in different cultures? Is there any evidence that it's fundamental to human beings, or like how do social and cultural circumstances affect this?
Great question. And I actually remembered one other question that I didn't answer before, so I'll answer that one. I think they asked if there's different types of purpose, and then yeah, there's qualitative research on this, and we see all kinds of things. It could be social justice cause, my family, religions, my work. So it really varies so much, but usually they're amplification of people's core values. And that's one way to think about it. So it's all kinds of things. Regarding culture, it's very interesting. There have been a lot of studies done on purpose and their conceptual cousins that exist in different cultures. Like Japan, it's called ikigai, reason to get up in the morning, and other cultures have I would say most cultures that I know of have a version of this, and they're all associated with better health outcomes in those cultures in the studies I've seen. Sometimes they're a bit weaker associations or even stronger associations, and they might relate to multiple factors like how collectivist versus individualist and these kinds of things. But relating back more to the specific question, there's this concept of derailment that can be applied to multiple types of life stages, and migration too is one of those as well. And I don't know specific research actually on migration and purpose, but if I were to imagine, yeah, people's value systems and personalities and ways that they relate to each other on a social connection level might have shifted quite substantially depending on the country of home origin. So that might be quite a derailment in multiple ways. And thinking about all those components and helping them find kind of both adjustments that they want to make, but also, I guess, similar communities at the same time might be an optimal way of creating an environment in which purpose can flourish. And, these are fantastic questions, and some of them, these are, wow.
Awesome. Actually, yeah, this is a follow-up question to that, I believe. Do you think it would be possible to build a society where health is unrelated to sense of purpose? And do you personally think that would be a worthwhile goal?
Where health is unrelated to sense of purpose. I and others agree that purpose is one of the core fundamentals for human well-being. Because if we take away, for example, purpose, but also one step back, just the act of striving in the first place, then if we think of a world where there's no striving, then it's a kind of funny world to think about. So I guess there are scenarios where people, where a world like that can exist, especially with the subgroups of people who have orientations that are not so overweighted on purpose, but it's harder to think about. Yes. I don't know if I fully answered that question, though.
Awesome. Yeah, no, it's definitely an interesting question. I'm also curious, like kind of personally on that note around health and different kind of, I know you mentioned like somewhat more controversially, there have more studies with things like LSD and like psychedelics, and as opposed to say more traditional therapy measures. Like, are there any kind of in between treatments that you've seen that aren't quite traditional, quote unquote, but don't really cross the boundary of going into drug use that you've seen be very effective? Sorry.
I think volunteering is sometimes is kind of thought in a boring way for some people, but it can be very exciting. It's like enacting moral engagement, and a lot of people, some people think of volunteering almost as equivalent to therapy, especially if it's done in areas that people might want to kind of have been afraid of and need to explore more, or they've been hurt in that area, and then they can kind of reclaim that area by doing this type of work. Different types of meditation practice have actually been shown to increase purpose. There are specific types that appear to be more powerful, like loving kindness meditation. And then there are some other versions that are more powerful, but I don't remember exactly which ones. Religion, so that's a powerful one too. Joining large organizations actually is another one. So I don't like the act of war. I see the necessity of things like the army, but when people join organizations like this, which is an overarching goal, people's purpose generally increases. And so these are some of the kind of maybe, except for the last one, maybe the less traditional ways that I've seen in the literature.
Thanks. And so we do have, oh, actually, this is one that's just come in, but before getting into literature recommendations, but whether level of education tends to be directly tied to a sense of purpose in individuals or not.
A great question. I actually have some data on this. So this is yeah, this is box and whisker plots, and this is kind of like the median, and these are 25th and 75th percentile. So maybe this would be easiest to look at. So this is people with less than high school education, and college education above. And it ranges from a score out of 6. It does range from about 4 to about 5, which is actually kind of smaller than some people might think. So there is definitely a gradient where the more education, the higher levels of purpose, and similar with levels of income as well. More income, more purpose. But again, the levels actually are not too different. When we actually look at it in relation to other outcomes, or like health outcomes, we see that people with high levels of purpose actually all benefit and appear to have lower risk of kind of like bad outcomes, no matter what your level of education or income or wealth is. However, if you have more middle levels of purpose, if you are lower SES, some of the health benefits are a bit diminished. And what we think is that some of the pathways through which purpose works are kind of disabled. So for example, if we think about lower SES people, I think about my childhood, and yeah, we didn't have great parks and streets and things like this. So even if someone had higher purpose, it might not be so easy to exercise. So that, however, that means that if policy changes are made for to kind of decrease some of these disabled pathways, that might be a way in which to kind of re-enable the power of purpose on health outcomes. Yes.
All right, I think we'll for our last couple of questions here, they're around literature recommendations. So one is specifically asking about a book, Oliver Burkeman's 4,000 Weeks, and his idea of cosmic insignificance therapy. And the other one is more broadly recommendations for literature on this topic that are in other languages, specifically in Chinese. So maybe starting with Oliver Burkeman's book, if it's one you've come across, the question is, he seems to be arguing we set our standards for purpose too high and set ourselves up for failure when we don't change the world or quote unquote leave a legacy. Thoughts on the pros and cons of recalibrating purpose to find value in more mundane things?
I haven't read the book, but there are people that I have met and done met in therapy and also done group qualitative interviews with, where people's purpose are simpler. They're, for example, a grandma is like, I work on this garden, kind of it. I just like seeing things grow, and I can help grow some vegetables for my family. And I think it's more humble, but that person finds it quite fulfilling. And I didn't track that person empirically, but they may have similar health benefits too. I agree, though, the sentiment that I think society has really put purpose and it keeps like elevating the level of purpose you have to achieve. They're like, oh, you have to change the world or something, but I don't necessarily think that's the case if we want to see different outcomes. I think people can have all types of purpose of all varying degrees, and it could be beneficial in multiple types of ways. Yeah, sorry. Yeah.
And yes, just the last question was, any recommendations for literature on this topic in other languages? And this person is specifically asking for those in Chinese.
Do not know, unfortunately. Yeah, one of my favorite books is Man's Search for Meaning. So maybe that has been translated. I'm not sure. Yeah, I'm sorry, I don't know.
Yeah, I think yeah, thank you all so much for the great questions. Some great discussion here. I'll just pass it back over to David just to say a few words in closing.
Great. Well, thank you so much. Yeah, those are great questions. I think a lot of these would be well handled in a dinner party too. I think because they certainly each question leads to others. And yeah, what if the sense of purpose is held very strongly, but the purpose is to do something bad? And then how does, because I'm sure that happens sometimes, you must have seen it. So we got a lot more to dig into, and I guess, an invitation to everybody on the call. So the team at Thrive is working closely with Dr. Kim on a lot of this work, and really the idea is to understand how people are feeling in organizations and help to figure out what the best next steps are. And as we've been seeing through COVID, we've got these thousands of organizations who are coming onto the platform to handle their rapid screening and other day-to-day COVID things. But there's a lot of interest for just using that same vehicle as a way to get a snapshot of well-being. And certainly, I'd argue that employers are ahead of the healthcare system as a whole for accepting that these things really are going to influence outcomes. And for example, with hospitals, we've asked tens of thousands of surgical patients about their brief inventory of thriving, about sense of purpose. Do they have a best friend? Overall happiness. And it's interesting that a lot of the clinicians don't see the relevance of that to people's healthcare journeys, even though there is research, just like in, people don't perform as well in jobs and are more likely to move around if they don't have that sense of purpose and well-being. Likewise, people are less resilient through healthcare journeys as a whole. So there are so many of these things that are connected, and it's been really fascinating to see, just those interactions between our inner selves. And I think it's worth mentioning, that at Thrive, we do have a lot of people with a strong sense of purpose, yes, for what we're doing, but we also have, amazing athletes and artists and community activists for doing things that, aren't directly involved with what we do as a company, but it makes, it makes those people extra passionate and valuable to their peers, and, makes the life more interesting as well. So it's been really a wonderful experience to hear this overview, and I think it's given us all a lot to think about. So we'll leave everybody with 1 minute to spare here. And thank you so much, Eric and Marie. Anything more for following up? Because we can follow up with people if they have more things they want to jump into after this call.
Yeah, absolutely. So I'll pop it in the chat here. If you have any follow-up questions for Dr. Kim or for us here at Thrive, you can send them to the same address that you saw in your invitation, so marketing@thrive.health. I've just put that in the chat for any questions from the presentation or anything you'd like to discuss further. And again, thank you all for the fantastic thread of questions today.
Great. Thanks, everybody. Have a good rest of your day, and happy holidays.